the Ga-Chuene Clinic near Lebowakgomo in Limpopo remains closed. This is despite earlier plans to reopen today. This comes after a horrifying incident in which two nurses on night shift were abducted and raped by an armed man. Now, to unpack the situation further, we cross to our reporter Katlego Nyoni, who's watching the story for us. So, Katlego, what plans are there in place to ensure the safety of healthcare workers going forward?
Certainly quite a very good question, Mdolisi. We know that for now, patients around Ga-Chuene will not be able to access the Ga-Chuene Clinic as it remains closed indefinitely. The health department in the province has provided various reasons, citing that it needed to thoroughly reassess, looking at the impact that the previous incident of the abduction as well as rape of two nurses might have had on the staff as well as the two nurses. Let's bring in the spokesperson for the health department, Neil Shikwambana. What were some of the main reasons that informed your decision to close the clinic?
Thank you, Kat. I think I need to first start by indicating that this was not an easy decision to arrive at, considering the implications that this will have on the community members as well as the public in general. But I need to indicate that we do have a responsibility towards while we need to balance the need to deliver services in the area, we also have a responsibility towards our healthcare workers in that area. So the reasons that made us to get to that decision is because we felt perhaps we were hasty in our decision to reopen the clinic because of the pressure to deliver service to the community and somewhat unconsciously downplaying the effect and the impact that this incident might have had on the staff in the facility, the post-traumatic stress and the psychological effect that has had. Because upon trying to open the clinic yesterday, for instance, only 2 people came and they were also not happy by being there, and the rest called in sick, and we had to go closer to them to understand what is happening and realize that this is far much deeper than we thought. We need to be sensitive to the needs as well as the concerns of the healthcare workers, because there's no point in actually forcing them to go there while they do not want to go there, because also, number one, the service will be compromised, but you're likely going to have a work staff that will always have take sick leave, and it will be the community that will continue. So we felt we needed to deal with this first, ensure that it comes to finality before we can take the staff members there, because staff still feel unsafe. There are rumors that perhaps SABC will be able to corroborate that there are a number of rapes that have happened in that particular area, not necessarily in the village, but in the area, which remain unsolved, which also makes our staff feel uncomfortable to be there with at the backdrop of what has just happened.
Neil, looking at the fact that now patients have been redirected to other clinics in neighboring Gamaja, Soetfontein, as well as Lebowakgomo Unit B, some of the patients that we spoke with this morning mentioned that they don't necessarily have the finances for the taxi fare, the money for the taxi fare, to be able to reach these clinics. Is there any way that the Department of Health could potentially assist in this scenario?
Certainly, this is not that has ever happened before, and I can't say this is something that we are actually contemplating, but suffice it to mention that our ambulances are still available in cases of emergencies to take the community, whoever of the community who might need emergency care, to be able to take them to the casualty of Lebowakgomo Hospital. So in terms of providing taxi services, we might not be able to.
Thank you very much. That's the spokesperson for the health department there, Neil Shikwambana, speaking to the fact that the Ga-Chuene Clinic remains closed for now. Back to you in the studio.
Katlego Nyoni, our reporter watching that story. Thanks very much indeed for that update.